Piles, also known as hemorrhoids, are swollen and inflamed blood vessels in the rectum and anus. They can be a common and uncomfortable condition, and they often result from increased pressure in the lower rectum. There are two main types of piles. Internal hemorrhoids. These occur inside the rectum, so you typically can't see or feel them. They are covered by a mucous membrane, which is why they are less painful than external hemorrhoids. However, they can still cause discomfort, bleeding, and sometimes prolapse protrusion if they become more severe. External hemorrhoids. These develop under the skin around the anus. They can be felt as lumps or bulges and are often painful, especially when sitting or during bowel movements. They may also cause itching and bleeding. Here is a more detailed explanation of what happens in piles. Causes. Piles can result from various factors, including straining during bowel movements. This is often due to constipation or diarrhea. Chronic constipation. When you strain during bowel movements, it can put pressure on the blood vessels in the rectum and anus. Pregnancy. The increased pressure on the pelvic area and hormonal changes during pregnancy can contribute to the development of piles. Obesity. Being overweight can also increase pressure in the abdomen, leading to piles. Aging. The tissues supporting the veins in the rectum and anus may weaken as you get older, making you more susceptible to piles. Sitting for extended periods. A sedentary lifestyle can also contribute to piles. Symptoms. The symptoms of piles can vary depending on their type and severity. Common symptoms include pain or discomfort, especially during bowel movements. This is more common with external hemorrhoids. Itching around the anus. External hemorrhoids can be itchy. Bleeding during bowel movements. Blood may be seen on toilet paper or in the toilet bowl. A lump or swelling around the anus. This is typically associated with external hemorrhoids. Mucus discharge. In some cases, you may notice a mucus discharge after a bowel movement. Treatment. Treatment for piles depends on the severity of the condition. Mild cases can often be managed with lifestyle changes and over-the-counter medications, including dietary modifications, increasing fiber intake, drinking plenty of water, and avoiding constipation-inducing foods can help. Topical creams and ointments. These can provide relief from itching and discomfort. Sitz baths. Soaking the anal area in warm water can help reduce pain and inflammation. Medications. Over-the-counter pain relievers or stool softeners may be recommended by a healthcare provider. For more severe cases, or if conservative measures do not provide relief, medical interventions may be necessary, including rubber band ligation. This procedure is often used for internal hemorrhoids. A rubber band is placed around the base of the hemorrhoid, cutting off its blood supply, causing it to shrink and fall off. Sclerotherapy. An injection is used to shrink the hemorrhoid by causing it to scar. Hemorrhoidectomy. Surgical removal of hemorrhoids is considered for severe cases when other treatments have failed. It's essential to consult a healthcare provider for an accurate diagnosis and appropriate treatment plan if you suspect you have piles. Left untreated, piles can worsen and cause more significant discomfort and complications. Additionally, maintaining a healthy lifestyle with a high-fiber diet, regular exercise, and proper hygiene can help prevent the development or recurrence of piles. Home remedies can be helpful in managing the symptoms of piles, hemorrhoids, and promoting healing, especially in mild cases. However, it's essential to consult a healthcare professional for a proper diagnosis and to rule out any underlying conditions. Here are some home remedies for piles. Dietary modifications. High-fiber diet. Eating foods rich in fiber can soften stools and make them easier to pass, reducing the strain during bowel movements. Fiber also helps prevent constipation, which is a common cause of piles. Include plenty of fruits, vegetables, whole grains, and legumes in your diet. Fluid intake. Drinking plenty of water, at least 8 to 10 glasses per day, helps prevent dehydration and keeps stools soft. Warm sitz baths. Soaking the anal area in warm water for 15 to 20 minutes several times a day can help relieve pain, itching, and inflammation associated with piles. You can do this by sitting in a bathtub or using a sitz bath, a small basin that fits over the toilet. Topical treatments. Over-the-counter creams, ointments, or suppositories containing ingredients like witch hazel, hydrocortisone, or aloe vera can provide temporary relief from itching and discomfort. You can also apply a cold compress wrapped in a clean cloth to the affected area to reduce swelling and provide relief. Witch hazel. Witch hazel is a natural astringent that can help reduce swelling and soothe irritation. Soak a cotton ball in witch hazel and apply it to the affected area. Aloe vera. Aloe vera gel can provide a cooling and soothing effect on the affected area. Apply pure aloe vera gel to the piles for relief. Herbal remedies. Horse chestnut and butcher's broom are herbs that have been traditionally used to treat hemorrhoids. They are available in various forms, including capsules and ointments. Consult with a healthcare professional before using herbal remedies. Proper hygiene. After each bowel movement, gently clean the anal area with soft, moist toilet paper or unscented, alcohol-free baby wipes to avoid further irritation. Avoid using harsh or scented soaps in the affected area. Avoid straining. Straining during bowel movements can worsen piles. Try not to delay going to the toilet when you feel the urge to have a bowel movement. Lifestyle changes. Engage in regular physical activity, such as walking or other low-impact exercises, to promote better bowel function and circulation. Maintain a healthy body weight to reduce pressure on the rectal area. Avoid sitting or standing for extended periods. Take breaks and move around if your job requires prolonged sitting. Keep the anal area dry. After cleansing, make sure the anal area is thoroughly dry to prevent moisture-induced irritation. It's important to note that while these home remedies can provide relief from piles symptoms, they may not cure the condition entirely, especially in more severe cases. If you experience persistent or severe symptoms, consult a healthcare provider for a proper evaluation and treatment plan. In some cases, medical procedures or surgery may be necessary to treat hemorrhoids effectively.